Hello, this is Dr. Do again. This video is still on alphabetic list of problems on letter N. Today I'm going to talk about not a disease, but just in general, newborn care for those young mothers. First of all, congratulations for this achievement of your life. I think it's wonderful. You probably already know it. Probably this video is for those who just become a new mother, or those who are ready or preparing or expecting. I think in terms of medical standpoint, you probably know your physician already told you before you were discharged from the hospital how to take care of a newborn, bring home, and it's a change of life. First of all, I'm going to bring up the emergency situation for the newborn. What are the signs to look for? You probably know it. I think the basic is pay attention to your newborn. If the newborn did not have the strength to suck the milk, or become blue, or the temperature is really low, or feel like you look like behavior is different from normal. So just these probably are the sign of the serious infection or serious problems. So bring to the physician. And the breathing, watch for the breathing, either too fast or too slow, too deep or too shallow. This is from the contact, daily basis, from the caregiver, either the mother or the other caregiver, and to the infant. So this is the first priority to the emergency. And on top of that, I think the mother's emotion, the mood of the mother is very important. It seems the newborn is sleeping, does not know, but with the growth, with the attachment between the mother and also the infant, and the mood change associated with the chemicals, especially for the breastfeeding. So the mood of mother is also very critical. There are a lot of postpartum blue and the postpartum depression beyond the time. So for those mother who's really undergoing the stress and hard to adjust, I think it's probably the best way is to talk to your physician, and with help from your physician to adjust your mood in order to carry your newborn. And in terms of newborn, first of all, breastfeeding is the best of all because it provides all the antibodies. The newborn infant is still carrying the antibodies from the mother passing the placenta, and also the breastfeeding. I think is the best for the infant. For those who cannot provide the breastfeeding, then the formulas, of course, plus and the vitamins and whatever the physician recommended you to feed your infant. And also for the immunization, I'm going to talk about the immunization and the regular visit. 2 weeks after the baby and the mother discharged, just 2 weeks to follow up, make sure if you have any questions during this 2 weeks in terms of how to care the baby, how to manage yourself, and how to schedule your breastfeeding. Talk to your physician. If you have any questions, just do not hesitate. This is a good opportunity, not only for the physician to see your child, also for yourself to address any concerns. This is the best time. And then the other 2 months visit, of course, this comes with the first immunization after discharge. I think it's in terms of immunization, it's really the benefit for the infant in the long run. And in addition to school required immunization, and also for the health, in medical standpoint, the immunization is really necessary for the preventive care. Those are the settled schedules: 2 months, 4, 6 months, and then year, and 2 years. So this is a different kind of variety of immunization. That is the standard of care. And the video I brought up here is just to encourage the mother to catch up the immunization schedule with your child. And the other, the newborn care, the other important signs to look for a healthy newborn is the activity of the newborn. Sometimes where the new mother disturbed by the crying of the newborn, so thinks that's not good. However, if the quiet newborn, usually crying and cooing and talking to you a lot, suddenly becomes quiet, that's not a good sign probably. Or maybe the infant feels sleepy, sluggish, and you feel the temperature is not high, however it's low. That's not a good sign. So bring to this to your physician, talk to your physician, or bring to the office or emergency room to get it checked. Some common problems for the newborn. First of all, it's very common, very easy to care. The diaper rash, of course, you know it. Your physician will guide you. And A&D cream, I think, serves the best. Or if it's not getting better, talk to your physician. Probably there's some prescribed creams, but usually the A&D cream will take care of this. And also in terms of the rash, there are different kind of rashes. And if the rash came without any fever, without any change of your infant behavior, like no decreased strength of sucking milk, or no decreased feeding, no decreased sleeping, or no increased sleeping time. If that's the rash, then just the minor skin reaction to the new environment, so it will go away. If not, then if you're really concerned about it, then call your physician, and the physician examine your infant and see whether need some cream or just monitor, or just observe, and it's going to go away. And the other important newborn care is the burping. I think it's so critical because the infant stomach and all the organs is still undergoing development. So the burping is because the muscle, the circulatory muscle between the esophagus and the stomach is not very well developed. It's not closed up yet, or not strong enough to close, like the banding of prevent the reflux. So the burping at 30 minutes after each feeding, that is really important to prevent the aspiration cause the infant pneumonia. That's quite serious. And so that's the other important, seems minor, but it's very important in terms of newborn care. And the other important, I think it's quite important and easy to do, is to talk to the infant, start from early age, even though you think probably the infant is sleeping or it's not understanding, but I think daily talking to the infant, binding this to establish the binding between the parents and the infant is critical for later on the behavior, emotion, and also physiological development. So these are very straightforward, very simple, but just hope the video here can remind you, and especially the new mother is quite busy, a lot of things going on, so probably sometimes forget here or there. So this video, I hope it helps to remind you. And thank you for watching. I will see you next time.